So, good afternoon to all. Am I audible?
Yeah.
Yes. Okay.
Good evening, madam.
Good evening.
Yes, ma'am.
Today's clinical meeting shall begin within 2 minutes. Thank you so much for joining on time. I request everyone to please keep your mic mute. It is immense pleasure to me to welcome you all on behalf of Maharashtra University of Health Sciences, Nashik. Myself, Dr. Karle Gitanjali, Professor and Head of Ayush Department of University. Today, in this clinical meeting, we are going to discuss 2 cases of carpal tunnel syndrome, and we have 2 PG scholars and subject experts from all the pathways to discuss the cases of carpal tunnel syndrome. So, without wasting my time and your time, to present first case, I would like to request Dr. Hina Sheikh, who is PG scholar from J.J. Maktoum Homeopathic Medical College, Jaisinghpur. Dr. Hina?
Yes, ma'am. Good evening, ma'am.
Good evening. Please share your PPT.
Am I audible, ma'am? And visible?
Yeah, you are visible and audible. Go ahead.
Yes. Good evening, all of you. Then I am sharing the homeopathic healing from a carpal tunnel syndrome, a case study report. Yes, ma'am.
Please turn on presenter view. Full screen.
Yes, ma'am, sir. Yes, then I am sharing our knowledge on homeopathic healing from carpal tunnel syndrome, a case study report. And I am learning in college Dr. J.J. Maktoum Homeopathic Medical College, Jaisinghpur. What is the carpal tunnel syndrome? The carpal tunnel syndrome is the name for a group of problems that includes the numbness, tingling, weakness, or pain in our wrist or the hand. It is a very common condition that happens when our nerve in wrist, that is median nerve, becomes squeezed. The carpal tunnel is a narrow opening between the bones in our wrist and the which ligaments holded are them together. A nerve called the median nerve runs from our lower limb through the carpal tunnel and into our hand. And this nerve produces the feeling to our thumb and 3 fingers. And it also helps to move the thumb or movement of the hand. Means in a introduction, I will give about what is carpal tunnel and what is carpal tunnel syndrome. Then it is formed by the carpal bones behind and flexor reticulum in front. It contains the median nerve and long flexor tendons of the fingers and the thumb. Tendons also run from our lower limb through the carpal tunnel into our hand, and the tendons connect to the finger bones into the muscles, so we can bend our fingers or we can move our fingers or hand. The tendons become swollen or irritated. Means if tendons become swollen or irritated, then inside the carpal tunnel, then our nerve get damaged and it may get squeezed, and which will not work. And this is called as a carpal tunnel syndrome. Means any injury to wrist, then when median nerve gets squeezed, then it is called as the carpal tunnel syndrome. That is the picture of carpal tunnel syndrome, which provides nerve supply to our thumb and first 3 fingers, and that is. Then what are the causes of the carpal tunnel syndrome? In certain cases, the causes of the carpal tunnel syndrome are unknown, but measures are injury to our wrist, which causes any swelling or sprain or any broken bones, or any health condition that affects nerve joints, means diabetic, rheumatoid arthritis, any cyst to our wrist, or any changes in the hormones, which mostly we find in menopausal age, or in pregnancy, or any hypothyroidism, or any problems with the way our wrist is formed. And doing the same movement, same wrist move and hand movements over and over, that is doing assembly line work, or any carpenter means carpenter who use their hand many times. That's why median nerve get damaged due to movements using tools that vibrate, or any gardening, or any sports such as golf. In golf we use mostly our hand, so movement of the hand that causes also compression of the median nerve, that also gives a to carpal tunnel syndrome. Then long-term use of computer using, means who are using a computer-based job, or mostly engineer, computer engineers in that, or any typewriter, or in any typewriters. Who is more likely to develop the carpal tunnel syndrome are mostly happening in adults, who are more likely to develop it, and mostly are in women than men. That is, women are 3 times more likely to develop a carpal tunnel syndrome than the females. Have a health condition that may affect the structures in our wrist, or any activities with repeated hand motions, or have any wrist injury, or genetic मध्ये close relatives, or who had a carpal tunnel syndrome, such as parent, brother, or any sister. The symptoms. In symptoms, what symptoms are? That is numbness, tingling, or burning in our fingers, especially in thumb, index, and middle fingers. Symptoms often affect both hands. In early stages, mostly symptoms are very slow, and are mostly in one hand. That is, with one hand we can write, or we can do, means which hand mostly used in any condition, or happens at night if you sleep with your wrist bent, or sometimes may feel electric shock sensation in the fingers. As symptoms get worse, you may notice that is tingling, pain, or weakness with the certain activities, like while driving, or holding anything, cup, or anything while holding, or difficult in grasping or holding the small things, or feeling like your fingers are swollen, but they are not. Means actually they are not, but there is only sensation, or we like a feeling, or as if feeling like a swollen feeling. And now I discuss about the case. That is, a 45 years female patient came with the complaints of pain and stiffness in the right hand, and pain and stiffness was felt more on waking in the morning, or while on the doing any work on the laptop. Then pain extends from right hand to whole right upper limb, and then radiate to the shoulder, mostly at the night. Now these are the main chief complaints. Now in detailing, there is first numbness and stiffness in the right hand since 2 to 3 months. There is location in the right hand, sensation, that is numbness and tingling in the right hand. Mild stiffness is felt in the fingers. Then the stiffness is more in the morning, and that is severe stiffness. Means stiffness is actually from 2 to 3 months, but more stiffness is since 1 month back. That a patient can't hold up any cup of tea or any knife with the right hand, or she cannot able to cook her food or comb her hair. Then after 2 to 3 hours, stiffness start to decreases, and the modalities are more worse in the morning. Then there is a pain in right hand. The pain also since from 1 to 2 months. Location is right hand. Sensation when there is numbness. Modalities means there is aggravation during night sleep, and due to pain, patient can't hold anything. Even she can't hold any cup of tea, or even can't comb her hairs also at night. And the pain is more at night, but stiffness is more on morning, but pain is more at night, and it is felt in whole upper limb since 1 month. On personal history, patient is obese, married, working woman in company, having computer-based job. Doing PCA, so he is doing computer-based job. Past history, he had taken for the same complaints, taken allopathic treatment, but can't get relief. Then she has a history of lichen planus at the age of 28 years and taken allopathic treatment. Family history means husband, daughter, all are healthy, but mother is hypertensive and having lumbar spondylolysis. On physical general, the appearance of patient is obese, taking good meals three times a day, and has a short quantity of large interval of drinking water, that is 2 liters daily. She can drink water. Desire and aversion, there are no any specific desire or aversion. Stools मध्ये satisfactory, urine clear 5 to 6 times a day or 1 to 2 times a night. And on sleep is sound sleep, refreshing. There is perspiration, that is scanty perspiration. On perspiration, no staining, no any smelling. On thermals, she can require fan, covering not required. So she hot patient, but he cannot wear any woolen things. When I ask her, can you wear any sweater or jacket in winter? She said, no, I can't wear any woolen things. So she is a hot patient. Then menstrual history, menarche is 13 years of age. Now there is a copious menstruation since 6 to 5 months. Then before that, the regular menses 5 to 6 days flow, profuse bleeding. Now the color of bleeding is dark and clotted, and there is mild backache and pain in the lower abdomen during the menses. On off history, she has a 21 years female child, normal delivery with a full month pregnancy, 9th month pregnancy. The mental symptoms means when she came, she was very expressive. When I asked about her complaints, then she starting very she said all complaints with expressive. During case taking, she told her all complaints in detail. Then she got mixed up very easily with me when I asked about her complaints or any physical or any mental complaints, or then she told her very easily. Then she got angry easily, and anger was very violent. And when she used to angry, she shouts in anger. She turned revengeful in anger also. Jealousy was a mark. Then jealousy about her siblings, her friends, and her colleagues. She was suspicious as well, did not want to disclose her identity or house address to unknown people. She had a fear of water, fear of high places, fear to cross bridge, and she prefers to wear a loose clothes also. Then about totality, about mental generals, anger, violent, revengeful, jealousy is marked, suspiciousness, fear of water, fear of high places. On physical general, hot patient can't wear tight clothes. She always prefer to wear loose clothes. Then particular general, pain in right hand aggravates during night sleep, and stiffness in fingers more on right side, aggravates in morning on waking up. Then that's repertorization sheet. I took rubrics: mind, hatred, revengeful, then jealousy, fear of high places, fear of water, suspicious, extremities मध्ये pain aggravated at night, and stiffness aggravated more on the morning. And on my mental symptoms मध्ये anger, violent, and mainly complaints she said about their clothing, that she wears only loose clothes, she can't wear any tight clothes. So on repertorization, Lachesis, Nux, Omica, Calcrea, Lachesis, Nux, Omica, and Calcrea all three remedies get marked, but more symptoms covered by the lachesis. And the main why I choose lachesis, that mostly she get it's converted into an animal kingdom. She has jealousy, then a hatred feeling, anger. That's why I choose animal kingdom. Means I select animal king and remedy from the animal, and due to the high mark in jealousy, then hatred feeling and suspiciousness. That's why. And the main complaints for choosing lachesis is can't wear any tight clothes, or she require only loose clothing. That's why I recommended her lachesis. That is selection on the basis of totality of symptoms. That Dr. Hahnemann says totality of symptom is outwardly reflected picture of the internal essence of the disease. And on totality of symptom, that is hatred feeling, jealousy, fear of high places, fear of water, suspiciousness, pain mostly at night, stiffness mostly aggravated on morning, violent anger, and can't wear tight clothing. So I choose prescribe her lachesis 30, given for 8 days. Then after 8 days, she comes to first follow up. There is a slight improvement in the pain and stiffness of the fingers, but night pain also present, and stiffness also, means the complaints reduce about 30 to 50% about complaints reduce. Then on second follow, pain and stiffness reduce, but the night pain still present. So I use I prescribe higher potency, means lachesis 200, then placebo for 15 days. On third follow, there is marked improvement in the symptoms and patient feels better. Thank you. On discussion, there is a carpal tunnel syndrome is most often in people of ages 30 to 60 years. It is more common in the men than women, and this patient has marked mental symptoms. That's why I give lachesis due to the mental symptoms. Means I mostly prescribe on the mental symptoms. Then there is a clinical signs and symptoms of the carpal tunnel syndrome, which the patient presents with the weakness and the stiffness, which worse in the stiffness worse in the morning, and the pain is worse in the night. And the main symptom for the prescription is a tight cloth aggravates, which is marked in the lachesis. And in this case, it was observed that there is a marked jealousy, violent anger, hatred feeling, revengeful, and the fear of many things, that is fear of water, fear of high places, suspiciousness. And then this can lead me to the enough for the prescription of lachesis. Thank you.
Thank you, Kalyani. You have taken lots of efforts. Thank you so much. Now, to present next case, I would like to invite Dr. Kalyani Dhadiwal, who is PG scholar from Srimati KB Abad Homeopathic Medical College, Chandwad, Nashik. Dr. Kalyani,
Yes, ma'am. Thank you, ma'am.
please share
Can
your
I hear, ma'am? Good evening, everyone. Myself, Dr. Kalyani Dhadiwal. I am PG Part 1 student from Srimati KB Abad Homeopathic Medical College, Chandwad. My topic is role of homeopathic medicine in the treatment of case of carpal tunnel syndrome. Carpal tunnel syndrome. Carpal tunnel syndrome क्या है? Is an intermittent neuropathy of median nerve which runs from forearm into the palms of the hand of the palm of the hand, become pressed or squeezed at the wrist. It is the most 3 times most common in women than men. It causes paresthesia, pain, numbness, tingling, and burning in the palm of thumb and finger, except the little finger, particularly in the index and middle finger and the radial half of the ring finger. It weakness and atrophy of the thumb muscle may occur if the case is remain untreated. The normal pressure of the carpal tunnel has been defined as a range of 2 to 10. It also seen in those suffering from comorbidities like hypertension, diabetes mellitus, hypothyroidism, rheumatoid arthritis, and the types of work that are associated include computer work with vibrating tools, and work requires a strong grip. The discomfort it usually occurs at the night and in the morning. This is the picture of carpal tunnel syndrome. Now I explain my case of carpal tunnel syndrome. A 50-year-old woman came to me for on 3rd June 2021 with the complaints of pain and paresthesia in the left hand of thumb and fingers from last 1 to 2 months, and her complaints are aggravated in the morning and in a change of weather. She also underwent the treatment for cervical spondylosis from last 8 to 9 months. That time she had suffered from the pain and radiculopathy from descending to the left arm. The documents are not available. I have past history. She has taken allopathic medication for cervical spondylosis before 8 to 9 months, but she has no result. In physical journals, appearance is wearing spectacles, partially groomed, restless, and fidgety hands. Appetite good. She can't tolerate the hunger. She always wants to eat something. Cravings for sweets, aversion to milk, and sore. Thermally, the patient is chilly. She always wants open air, aggravation from sun. Uh, her sleep is disturbed due to the thoughts, continuous thoughts की वजह से उनकी sleep disturb रहती थी. Uh, Menstrual history. She menopausal woman from last 1 year. Obstetric history. She has a 3 girl child with normal delivery. लाइफ स्पेस ऑफ द पेशेंट का कॉर्डियल रिलेशन था उनके फैमिली के साथ. उन्होंने उनके बचपन के बारे में कुछ भी नहीं बताया, क्योंकि उनको बचपन के बारे में पूछने से वो इरिटेबल हो जाते थे. जब उनके पापा की डेथ हुई तो उनके घर की फाइनेंशियल कंडीशन अच्छी नहीं थी, इसलिए उन्होंने दूसरे के घर पे बर्तन मांजने का काम स्टार्ट किया ताकि घर पे फाइनेंशियल हेल्प हो सके. फिर थोड़े दिनों के बाद उनकी शादी हो गई. शादी के बाद सब कुछ ठीक चल रहा था, पर कुछ बाद उनके और उनके पति के झगड़े होने लगे थे, क्योंकि उनके पति घर में कुछ भी हेल्प नहीं करते थे, ना ही फाइनेंशियल हेल्प करते थे और ना ही घर की कुछ रिस्पॉन्सिबिलिटी लेते थे. वो उनके जो कमाए हुए पैसे थे वो सब दारू पीने में खर्च कर देते थे. उस बात से लेकर उन दोनों के झगड़े हुआ करते थे, और वो झगड़ों की वजह से और पति के पिटाई की वजह से वो इरिटेबल हो जाती थी, और उसके कारण उन्होंने 2-3 बार सुसाइड करने की भी कोशिश की थी, लेकिन उनके ससुर जी ने उनको बचाया था. उसके बाद उन्होंने बताया कि उनको 3 लड़कियां है, जो कि बड़ी लड़की की शादी हो गई है, जो बीच वाली लड़की है वो उनके साथ घर पे काम कर.
Proceed with the medical case.
Yes, ma'am.
Proceed with your slides.
Sorry, ma'am. Can I
Proceed with the slides. Case continue कीजिए कल्याण. Case continue करिए.
Yes, ma'am. Mental journals of the patient. Depressed, desire to be alone, weeping when alone, cooperative most of the time, anxiety about the future, suppressed emotion due to her grief regarding the death of her middle daughter, tried to keep herself busy all the time, to avoid the thoughts of middle daughter death. Fastidious about her work. Physical examination. One BP 160/90, pulse 80 per minute, SpO2 98, temperature of febrile. Systemic examination is normal. Local examination, tenderness in subscapular and midscapular region. Her tinnial sign is positive and Fallon signs also positive. That's why I diagnosed her carpal tunnel syndrome. Now my repertorial totality. I repertorize my case from the complete repertory. The complete repertory क्या है? Complete repertory is a world's leading homeopathic repertory है, जो डॉक्टर रोगर वॉन जैनवुड ने 1996 में डिस्कवर की हुई है. This repertory created with the help of first, third, and sixth American edition of the Kent repertory, and it is available in print and electronic form. My rubric is I have taken and general symptoms of the patients, death, elements from the aggression, loved ones, elements from aggravation, occupation, diversion, emulation, company, aversion to alone, emulation, when weeping, tearful mood, when alone, being emulation, dwells events on a past disagreeable, fastidious, religious affection, anxiety, future about, reproaches, elements from aggravation, sun aggravation, fasting, hunger aggravation, food and drinks. On my totality basis, I have prescribed her nitram carb 200 HS weekly. My follow-up, two follow-up of my case. First follow-up I had taken on 10th June 2021. That time, the significant improvement in her general sense of well-being. Her mood is stabilized. She is comfortable with the company, and weeping spells. Her weeping when alone is now reduced. Grief, her no grief. She is comfortably and happily living her past, and paresthesia and sleep have improved. And second follow-up, on 17 June 20, on first follow-up, I have I has prescribed her the remedy nitram carb 200 HS weekly. On second follow-up, 17 June 2021, she feels much better than the first follow-up. I have Monarch criteria. Evaluation of this case report done by using modified Naranjo criteria for homeopathy. What is the meaning of Monarch criteria? Monarch criteria is a causal relationship between the homeopathic intervention and outcome in clinical cases. Reports. It is a case selection. The more than 6, if the score is more than 6, we can say that the case is improved. If the score is below 6, then it is not improved. Maximum score is 13 and minimum score is 6. Monarch scale consists of the 10 domains. The case selection criteria for Monarch is case reports covering around the 9 items out of 30 on the generic care checklist, and a minimum out of 3 of a 6 as per the home case extension items. The Monarch tool is applicable for both acute and chronic cases. Conclusion of my case is from observations and her progress, it is concluded that homeopathic medicine have a significant role in the treatment of carpal tunnel syndrome. Homeopathy removes the cause of disease, treats from the roots completely recovered the sick ones, internal disorders, internal disorders, and represents the em- emotional instability from where the disease originates. Thus, homeopathic cures not just remove the symptoms of the disease. Thank you.
Very good, Kalyani.
Thank
You
you,
have
ma'am.
presented the case very well. So next to take the experts' opinion on these cases. First, I would like to request Dr. Sudhir Pawar, who is Professor and Head of Anatomy Department from Vithalrao Vikhe Patil Foundation, Medical College, Birhat, Ahmednagar. He is having 17 years teaching experience. So, sir, please share your opinion. Dr. Sudhir Pawar, sir. Okay. Dr. Ashutosh Oza is here from Modern Medicine. I would like to request Dr. Ashutosh Oza, sir, to share his insights on the carpal tunnel syndrome. Hello, Dr. Sudhir Pawar, sir, or Dr. Ashutosh Oza, sir? I think no one is there. Okay, we will proceed ahead. Now, I would like to request Dr. Manoj Kumar Chaudhary. He is a. Am I audible to all? Hello?
Yes, ma'am, you are.
Okay. Now, I would like to request Dr. Manoj Kumar Chaudhary. He is a member of Board of Studies for Ayurveda faculty, MOHS Nashik, and member of Board of Studies of the Datta Meghe Institute of Medical Sciences, Varga. He is a HOD PG coordinator at Ashtang Ayurveda College, Pune, and he is having more than 20 years teaching as well as clinical experience. So, Dr. Manoj Kumar Chaudhary, sir.
Hello.
Okay, Dr. Ashutosh Oza is here.
Okay.
Yes, now we can speak, ma'am, because we have muted. No?
Okay, sorry.
Okay. Thank you. Thank you, madam. It is a very good presentation. I add a few things. The first student had spoken about that the carpal tunnel syndrome is a disease of men. We don't know the cause, but mostly it is a disease of female. The age group is 30 to 80, which is a very big range. And as we age, the more and more the incidence of disease is occurring. Second is the carpal tunnel syndrome is mostly secondary. Mostly secondary, I repeat. They have got the polysaccharidosis. They have got hypothyroidism. They have got the connective tissue disorders such as rheumatoid arthritis. They have got vasculopathy, and they have got many times ignored is HIV. HIV is one of the important cause which can present like the carpal tunnel syndrome. Second issue is the carpal tunnel syndrome. The cure is surgical mostly because the disease process continues. And that is why you have to go and release the tendon, and that gives you a sustained cure. And last but not the least, associated psychological elements, which is often missed in our system, which is well covered by both the speakers. I really compliment them. Both the presentation was very good, and it is very nice. And the way she has come with the family history and the marital history, and then after leading to the depression and psychosis, is very well covered. I really compliment the both the presenters. Thank you very much, ma'am. Bye, ma'am.
Thank you, sir. You are in traveling, and but you are shown interest, or you are and you have given us your valuable opinion. Thank you so much, sir. So now next, I would like to request Dr. Sudhir Pawar. Okay. Next, again, I would like to request Dr. Manoj Kumar Chaudhary, sir.
Yeah, thank you. Thank you very much.
Okay, sir.
So really it was nice presentations by the PG scholars, and the concept of totality, which was explained by Dr. Dr. Hina Sheikh, is close to our Ayurveda concept of Prakriti. And the holistic approach of homeopathy is, adjoined with the Prakriti concept of Ayurveda. Dr. Kalyani from Chandwad Homeopathy Ayurveda College has also well covered, as Dr. Oza has described. So I would like to put forth Ayurveda views regarding carpal tunnel syndrome. So Ayurvedic management for carpal tunnel syndrome is having a very hopeful results as compared to the surgical approach. The curative and from the root cause treatment is a solution from Ayurveda for it. As it is, we all know that it is Dr. Carle ma'am is also from Ayurveda faculties, is well known about these things, that as carpal tunnel syndrome, it is not described, but by comparing the symptoms, it is a syndrome group of symptoms. It is moreover similar to Vatarakta, Vishwachi, Avabahu, Ekangavat, or Asthimajjagatavat. So here, you all might be heard about the Vata Pitta Kapha concept of Ayurveda, that the health depends upon the balance of these three doshas. So this disease is having a vitiation of Vata and Pitta. So to balance Vata and Pitta is the main concept to treat or manage this disease. And this balancing Vata and Pitta must be through Ahara and Vihara, that is the diet and the behavior or lifestyle changes. So we all know that the problem is in the neck, or the Griva Basti, that is the, we can say, local retention of the medicated oil locally at the upper back region or near close to the neck. So the medicinal oil is pulled in the body, by which the Vata dosha is well balanced. So central neurological or muscular diseases, this treatment is very useful. As well as for the local treatment, we can go for the lepana, that is the application of herbal paste. And this will help to release the discomfort in the muscles, joints, and the tendons. As well, the Vata balancing oils can be used, such as Mahanarayan oil or Bala oil. The best I would like to here discuss about the Nasya. Nasya is the nasal administration. In Ayurveda, it is said like that, Nasa hi Shirusodwaram. So Nasya will help to make the nerves more, we can say, strengthy, and it will bear the pressure, and it will balance the Vata. So according to Ayurveda, Shulam Nasti Vina Vata, means Vata is the main factor to create the pain. So if somebody wants to avoid the surgical treatment, he or she must go for Ayurveda management. So I will like to share some single herbs are also useful, like Rasna, or some medical, we can say the combinations like Gugul Tikta Grita, or now the capsules are also available like Gandha Tela, or Gugul Tikta Grita capsules are also available. So holistic approach of Ayurveda along with the Panchakarma treatments like Basti, Nasya, will definitely will have a solution for this disease, and some clinical studies has also undergone for the clinical trials has also undergone for the institute on the institute level. So thank you very much for giving me opportunity to share my views of Ayurveda also. Thank you very much, Dr. Carle Pawar madam.
Thank you so much, sir. And I am 100% agreed with you that you have told that Griva Basti.
Hello.
Griva Basti can work very well in the carpal tunnel syndrome because as there is an involvement of median nerve, and as we know that it is having root values from the brachial plexus, from cervical region. So your suggestion is very good, and thank you so much, sir, for your valuable opinion.
Hello.
Then next, Dr. Sudhir Pawar is here.
Yeah.
And, yes.
Hello. Am I
Yes,
audible, madam?
Yes, sir, you are audible.
Yeah. I'm extremely sorry that I could not involve right from the first due to the examination work. But last two cases I heard very nicely presented, madam, that regarding carpal tunnel syndrome. And I just want to say that this is very good activity, ma'am. So it's a platform. So distant people can combine together and have a sort of discussion. It will be very useful for the student as well as for teacher also. That is one part. Second is it was in between technical problem. It was not it was unmute mute. So I could not. Yeah.
Okay, sorry, sir.
With that it is okay. The case the topic was that carpal tunnel syndrome. So
Actually,
as far as anatomy part is considered. Hello.
sir, sorry for inconvenience. Actually, you have named Realme RMX. That's why I was unable to update you.
Okay, no problem, no problem. So as far as the syndrome is considered, carpal tunnel, and what exactly happening, right, due to the various causes that already that student have mentioned during presentation of case. As far as anatomy is considered, so one side there is a it is lined by the bones, carpal bones, and one side there is a flexor retinaculum. In between that, so due to the you can say edema or increased fluid level there is a compression of this single nerve median. Already Carle madam have told about that. So that mononeuropathy we can say about this. And due to the compression, all these problems are happening. So main aim is like surgical reducing that tension and relieving the compression, and that median nerve will work properly. So total 9 tendons they are running through that. One side there is a bone, bony margin, carpal bones are there, and one side there is a tough flexor retinaculum, which is modification of deep fascia there. So within that, all this is running, this 9 content, including this median nerve. So basic is that nerve is compressed, and we have to relieve that tension with the various medicines and all that. What the anatomical structure is disturbed, we have to recorrect it. So it was a very nice presentation. As far as anatomy is considered, my role, I think I can say that anatomy we should preserve it normal. So everything will be normal considering the disease. Various line of treatment we can give for that particular diseases. So we have to restore the normal anatomy. That is the main. So median nerve which is running through it below the flexor retinaculum, and only the palmar cutaneous branch of it which is going above the palmar that flexor retinaculum. So that is only escape. Rest of all the distribution of median nerve get hampered due to the compression, and we have to decompress it. So basically this is carpal tunnel, what we say syndrome, right? So very nice presentation. I like it. In future also with madam's initiation, right, we would like to discuss in this. Only thing is that due to some busy work, so I was not involved right from the first, but definitely next time, right, so we can have a good again, right, more involvement in this. So I'm very thankful to Carle madam also for this giving opportunity to attend in such type of the case discussions. So I'm very much thankful to madam also, university also, and rest of our senior colleague teacher also, and the students who are presenting. Thank you, ma'am. Thank you.
Thank you so much, sir. Very well explained in the anatomical perspectives. Thank you so much, sir. Next, I would like to request Dr. Ajay Omkarnath Dahad. He is a principal professor and HOD of the Srimati KB Abad Homeopathic Medical College, Sanwad, Nashik. He is member of Board of Studies for Homeopathy faculty for Maharashtra University of Health Sciences, Nashik, and he is having experience teaching and as well as clinical experience more than 30 years. So, sir.
Good afternoon, madam. Good evening. Actually, both the students, they have presented the case in a very appropriate manner, whatever the prescribed format given by the MUHS. Already the earlier experts, they have opined about it, the anatomy and Ayurvedic approach towards that particular case. Besides it, in that, I want to add, actually, the causative factor is very important, because without any causation, no disease or no person is going to suffer or affect from it. So it is very well said. The women are more prone to suffer. Even the age group is also like that of many of the times we are finding here there is a range is in two different age group. One is 50 to 55 and second is 75 to 85 years of age. And causation, what we experience or I have also seen in my clinical experience, repetitive movements, traumatic energy, injuries that are most of the times we are finding. So overuse or abuse of that particular part, that is also one of the factor. And besides certain other comorbidities, you can find out like that of earlier expert also narrated about it. That is HIV in rheumatoid arthritis and etc. But I find besides it's actually the fluid retention and diabetes is many of the times we are finding nowadays. Because rheumatoid arthritis, all the other joints also get involved. That's why it is very difficult to differentiate, particularly is it carpal tunnel or the other things or etc. As far as it concerned about the management, Kalyani has explained very appropriately because she has analyzed the case and a very comprehensive approach taken towards that particular thing. Because in homeopathy, we have to analyze the symptoms and find out what is the characteristicity in it. Unless and until we are individualizing that particular patient, we cannot arrive at the similimum. So as per the homeopathic approach, she analyzed the case in a very appropriate manner and found, because she enumerated what is the cause exactly. She found what is exactly the cause. Whereas in earlier case also, what Dr. Hina, she also narrated very nice. But personally, I could not arrive at the causation, because unless and until we find the causation, we cannot accomplish the totality. And in treatment of any disease or any patient, cause is very important. Okay, in other system of medicine or certain times we are finding the cause is unknown or idiopathic and etc. When we are unable, but we need to find out in homeopathy, very rarely such a type of incidences occur ki cause is unknown or idiopathic or we are unable to find out the cause, because without the causation we cannot accomplish the totality and we cannot arrive at similimum. Both the presenter has presented very well. In homeopathic approach, actually basically here what happened, the inflammation of the median nerve, and accordingly our concept is telling ki this is functional disturbances and the cause exciting and later on miasmatic also. And initially therapeutic, with the help of therapeutic treatment, we can avoid the surgery. Unless and until it is an irreversible pathology or structural change is there. So that can be ruled out by the investigations, either with the MRI or certain other investigation. Whereas Kalyani very appropriately narrated, even she has enumerated the symptoms and which symptoms got relief by that particular prescription, what she has prescribed. Dr. Hina also narrated very appropriately. So in homeopathy, there are several medicines we are finding on the basis of miasmatic or constitutional approach. Depend upon the case, is it acute or chronic? But usually such a type of cases, according to the symptom similarity and totality, we have to see. There are several medicines, Rustox, Caustica, Arnica, Lachesis, Belladonna, even Natrum Carp. These are the medicines are indicated. In my view, integrated approach is very much helpful in such a type of cases. As Ayurveda, physiotherapy, naturopathy, or other parts, Lepon and etc. what they told, I am not expertise of that particular thing, but that also much helps to minimize the intensity of the pain and reducing that particular thing and recovery of the patient. So in certain cases, we should have an integrated approach. So congratulations to both the presenter, and I am very much thankful to the MUHS and particularly to Gitanjali madam. Thank you very much, and thank you to all. Thank you.
Thank you, sir. And main objective is our one course, that is family medicine, and we will take help of this discussion in that course, right, sir? Yes, sir. Thank you so much for your valuable opinion. Thank you so much, sir. Then I would like to request Dr. Shahida from Unani. Dr. Shahida, are you here?
Yes, madam. Thank you. हाँ तो मैं थोड़ा हाँ मतलब मुझे तो बहुत अच्छा लगा. मैं लेट ज्वाइन की मैडम, मेरा नेटवर्क नहीं था इतना सही से. मेरा फर्स्ट टाइम मैंने.
So we can.
हेलो.
Please turn on your video.
अरे ओके. हाँ हाँ मैडम.
Yes. हेलो मैम.
मैं दरअसल कॉलेज की छुट्टी हो गई थी तो रास्ते में थी और थोड़ा नेटवर्क नहीं मिल रहा था तो मैंने सिर्फ सेकंड वाला प्रेजेंटेशन सुना. लेकिन मुझे बहुत अच्छा लगा. मैं ये चाहते कि मैडम हमारा भी इसी तरह यूनानी का भी ये सिलसिला शुरू हो.
Yes,
और उसमें इंशाल्लाह हम भी जितना हमारी तरफ से हो सका हम भी उसमें हिस्सा लेंगे और बच्चों को भी मोटिवेट करेंगे. कैसे मैडम इस तरह करेंगे तो बच्चे भी थोड़ा सा उनको एक एक केस दे तो उनके लिए भी पैथी को भी जानना और इंटरपैथी का भी रहेगा तो उनके भी रिजल्ट जानना और फिर उनको और मोटिवेशन और फेथ होगा अपनी पैथीज पर. तो हिसाब से उस तरीके इलाज को वो ज्यादा प्रीफर करेंगे. Thank you very much.
We are agree with you. But what is your line of treatment for carpal tunnel syndrome? I would like to.
Okay. मैडम हमारे पास ना सबसे पहले तो थोड़ा इसका पोजीशन सबसे पहले तो मेन एटॉमिकल उसको करेक्शन के लिए कहा जाता है. और मेन पेन किलर में हमारे को सुरंजान करके कोल्चिकम अबे सुरंजान करके आती है. दूसरा जो टेबलेट दी जाती है मेडिसिन हम लोग खासतौर से इसमें अजराकी जिसको नक्सोमिका उसका खासतौर से इस्तेमाल किया जाता है. और कुछ हमारे हॉस्पिटल में एक ऑयल बनता है जो रोगन परफ्यूम के नाम से जाना जाता है जिसमें क्या कहते हैं परफ्यूम जिसको हम तो नक्सोमिका कुचला या जराकी के नाम से हमारे जानते हैं. तो उसकी हमारे खुद कॉलेज के फार्मेसी में तैयार होती है तो वो हम लोग
यूज की जाती है.
हाँ हाँ तो उसको हम लोग देते हैं. और सुरंजान का एक फॉर्मुलेशन है हब्बे सुरंजान वो टैबलेट फॉर्म में जो कोल्चिकम लुटियम करके उसके साथ दो और दवाई जैसे ब्लेरिका ये हलीला करके हर और इसका इस्तेमाल होता है. और साथ ही साथ ऑयल हमारे यहाँ परफ्यूम करके बनता है जिसमें ये मस्टर्ड ऑयल में गार्लिक और एक परफ्यूम जिसको थुअर भी कहते हैं उसको मतलब पका के वो ऑयल बनाया जाता है उसका हल्का मसाज किया जाता है. और प्लस ये वर्क वगैरह के लिए पोजीशन उसको सीधी रखने के लिए हेवी वेट और लिफ्टिंग वगैरह से थोड़ा मना करते हैं. तो इस तरह का मतलब इसमें अक्सर पेशेंट का अल्हम्दुलिल्लाह जितने ज्यादा तो केसेस मतलब अभी हमारे यहाँ बहुत नहीं इसके है लेकिन फिर भी जितने हमारे पास है अल्हम्दुलिल्लाह इतनी दवाओं से तो काफी फर्क पड़ा है.
Okay, madam. Thank you so much. Thank you so much for your participation in this discussion. And now, after today's fruitful discussion, we will stop here. Again, shortly, we will be here to discuss another topic on the same platform. Till then, goodbye and have a nice time. Thank you. Thank you so much, sir.